and good morning. It is May 7, 2024. I'm Dr. Deuk Majin. Our patient comes from Canada. He's been suffering with back pain at L4-5, L5-S1 for years. And he also has piriformis pain, which is pain in his buttock. We diagnosed him with disc pain and piriformis muscle pain. We're going to start by fixing the discs at L4-5 and L5-S1. Shot. Looking good. Let's do some num-num. Our patient is sedated with propofol sedation. There is no tube. There's no general anesthesia. This surgery is outpatient. We've been performing this surgery now for 18 years. Here at Deuk Spine, it is known as endoscopic spine surgery. Endoscopic spine surgery is surgery done on the spine using a scope. Many of you are familiar with scopes used in medicine, whether it's gastroenterology or ENT. Scopes are commonly used. Now they're used in the spine. Not many surgeons know how to use a scope for spine surgery. Most surgeons do not know how to use a scope for spine surgery. We're using X-ray, lateral, which is side to side, and AP, which is front back views, to navigate and to localize. You can see the needle is in very good position. Jordan, show us the pedicle of L5, S1, and L4. So pedicle of L4 at the top there, circle, just circle it please. You can see a black line. Show us the black line of the pedicle. That's the cortical bone. Follow it around please. This big circle. Yep, there we go. Next one, L5. It's a little more oval right there. And S1. Big S1 pedicle, big S1 pedicle. Perfect. So I'm looking at those pedicles as I'm doing my surgery. Those pedicles are my landmarks. I need to pay attention to them. Lateral. Very good. Where do you feel that? Incision. We're going to make a 7 millimeter incision, and we're going to access L4, 5. Yeah, you can let him wake up because I'll need his help. Now I can tell you right now from his bleeding from that incision, it's minimal, but I can tell he's on anti-inflammatories or has taken anti-inflammatories or some type of a herbal medication. And the most common we see is like turmeric, ginkgo biloba, fish oil. A lot of people take those supplements. Shot. We always ask people to stop them. And the problem is we don't know all the supplements that are out there. And we don't know we don't know all of them that cause bleeding. Shot. But his bleeding is not significant. It's not going to keep us from getting the surgery done. It's just more, I would say, annoyance bleeding. Shot. If I felt that it was going to put him at risk, I would stop the surgery, but I don't think it is. All right, we are trying to make our way over to the L4-5 disc, and I'm trying to get a little bit more medial. I'm not happy with where I was. I want to be a little closer to the spine. There's the facet. That's what I want. Shot. Now I'm going to work my way around the side of the facet joint. And this surgery is basically relatively bloodless surgery. We will lose just a tiny amount of blood normally, unless of course somebody's on a blood thinner. Perfect. I'm really happy with the placement. Is he awake? Reliable? Shot. So this is about a nosebleed's worth of bleeding. Nosebleed's worth of bleeding. Just lay still. You're doing great. Not ready yet. Not ready yet. Take those off. We're not in the disc yet. All right. I just need him awake and helping me. Yeah, well, that's fine. Let's go ahead and get an AP view. Lay still. Lay still. You're doing great. So our patient needs to wake up so I can ask him some questions. Perfect. The needle placement is perfect. That said, I want to make sure we're not too close to any of the nerves where they could be irritating him. Let me know when you think he's awake.
How are you doing? Okay?
You're in surgery. Everything's great. We just need your help for a minute, okay? All right. We're going to do a discogram. A discogram is a procedure where we test the disc to see if it's hurting the patient. Shot? I'm right against the facet, and I'm his shot. Shot. Let's show our audience, Henry, how do disc herniations cause back pain? Okay, welcome back. You can see from our video that the disc, when it's torn and herniated, can cause pain through inflammation. We're going to check those discs right now and see if they're the source of his pain. Based on the location of his pain and the type of pain he's having, I believe that they are. He has an L5-S1 herniation, L4-5 herniation, and I believe these two discs are the source of his pain. He's had back pain for over 1 year. And I'll show you guys the incision. You guys see this tape measure?
Yes, we do.
It's about 7mm incision. All right, how's he doing? You awake?
How you doing, my friend? You okay? Yes, we're going to ask him a question.
All right.
He says, yes, he's awake. Okay, so you can ask him.
How bad is that on a scale of 1 to
Give
10?
us a number. 10.
Is that where you get your pain?
Don't move too much.
Huh?
He said that he gets more than he is laying.
Yeah, that's where you get your back pain, right?
That's right.
You're doing great. All right. How bad is that on a scale of 1 to 10?
8.
What's the highest it goes? 9? All right. Is that where you get your back pain? Okay, good. When you wake up, that pain will be gone, my friend. It'll be gone. Just go back to sleep. I want you to count from 1 to 100. All right, Henry, what we just found out is that he has back pain from both of those discs, so we're fixing the right discs. Now, the sacroiliac joint is right here, and coming off the sacrum is a muscle called the piriformis muscle. Okay, and it's fan-shaped, F-A-N shaped, and it's called the piriformis. It attaches to the top of the hip to something called the greater trochanter, specifically the posterior facet. And that muscle is torn in his case, and it's creating all kinds of pain in his buttock. We're going to release that muscle with a technique that we developed here at Deuk Spine. You're doing great. Keep counting. You want to do 5-1 first or 4-5?
It's up to you.
Let's go 4-5.
Is it fun?
Let's do 4-5 first. All right, so we're going to start with 4-5 so I can get it out of the way. And then we can focus on 5-1. The only reason is because the hilts are all the way down.
I see.
Can you hold that, please?
Yes, sir.
Shot. So I want to get the 4-5 is the easier disc to do. I want to get the 4-5 out of the way so I can get the needle out of the way, because otherwise it's going to be interfering with my scope and my tube. All right, some num-num. We're going to give this patient a little more numbing medicine, Novocaine, so that it's a little more comfortable for him. Shot. That's it. Oh yeah, oh yeah. Whoop. Put a little bit close to the nerve, but that might put the nerve asleep. So we'll just keep an eye out for that. Any questions from our audience?
Yes, these first two questions come from Izod on YouTube.
Izod, I-Z-O-D.
A-E-Y-Z-A-D.
Oh, okay, fine. Welcome to our live stream.
First question they asked is there any danger to the spinal cord while carrying out this procedure?
Well, the truth is there's always danger to the spinal cord, okay, no matter what procedure you do. Because when you have anesthesia, that could drop your blood pressure so low that your spinal cord doesn't get enough blood supply and it strokes out. So you could, any procedure in the world done with anesthesia is a risk to the spinal cord. But that said, there is no spinal cord here where we're working, so we're not going to hurt the spinal cord. So I would say the risk is virtually zero, except for the anesthesia risk. And we have a really good anesthesiologist. Wait. You think that's in far enough? Let's pull it back a little bit and see. Right now we're placing the tube that we're going to do the surgery through. Pull it back. Shot. And it looks like the tube might be in far enough. We're just verifying that. Shot. We use the x-ray to do that. Thank you, Luis. Again, he's a big guy, so he's taking basically the full tube. Normally for skinny people, the tube would stick out a lot more, but because he's so big, and I don't mean fat, I just mean he's like a Canadian bear, you know, like a grizzly bear. He's got a lot of muscles and stuff. So, point I'm trying to make is he's taking the entire length of our instruments, and because of that, I don't want this other needle interfering with, you know, the other L4-S1. That's why I did L4-5 first. But everything's going well. We've lost literally about 10 cc's of blood. That's it. This is bloodless surgery. There is the tear, okay? So we showed you a video earlier on what causes the back pain when it comes from a disc injury. That is it right there, the tear. We're literally at the very bottom of the tear. We're going to remove the herniation that's stuck in the tear. The herniation is blue, and it's blue because we stained it blue with a special dye called the Deuk Spine dye. Our colors are blue of our company, blue and gold. But so to further answer the question about the spinal cord, there is no spinal cord down here. The spinal cord ends at L1, sometimes L2. We're working way down below it. We're in a totally different zip code. Thanks, Nikki. Now what you're seeing here is the laser fiber. It's called the laser fiber, F-I-B-E-R. It's like an optical fiber. It's made from glass, G-L-A-S-S, glass. Like all optical fibers, it transmits electromagnetic radiation, which we all know that the internet uses optical fibers now that cross the ocean floor, and you can transmit information via these fibers by altering the frequency and wavelength of the impulse of electromagnetic radiation. And it's period. So we're actually taking energy from a machine here in the operating room that is on wheels. It's the size of a large suitcase. And when I say large suitcase, those of you know what I'm talking about. If you've done any international travel, you see those people from certain countries that have like the biggest suitcase you've ever seen at the airport, right? You didn't even know they made suitcases that big. You could fit an entire family in a suitcase that big. And that's what we have. We have a machine that's that size, and it is in the operating room here next to me, about 6 feet away, and it's creating this laser beam that comes out of a little hole or aperture on the side of the machine. This fiber is about, what, 9 feet long?
Around there, yes, sir. Yeah.
And it transmits that laser energy from the machine orifice where it's released over to the tip of this glass fiber. So I can surgically, as a surgeon, I can direct the energy out the end of this fiber. Now, there's a lot of misinformation on the internet about lasers in spine surgery. Lasers are the most precise tools in the world. There's nothing more precise in surgery than a laser. And what makes the laser surgically precise is the surgeon and the tools we use. Now, we need to have an endoscope, which is what we're using to see the tip of the laser. And to give you an idea, that glass fiber right there is 1 millimeter, 1 mm, 1 millimeter across from side to side. The one we use for the cervical scope, the smaller scope, is half of a millimeter. It's actually 0.45 millimeter. And the point I'm trying to get at is that because we're using the scope, there's the inflammatory tissue right there, Henry, look at that. It's beautiful. So we just showed you a video. There's a small area of inflammation inside the tear. That's it. And Henry, I want you to show the video on how the Deuk laser disc repair removes the painful inflammatory tissue.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
You can see from the video what I'm talking about. The laser is used to clean out this tear that is causing pain in the patient's back. The pain comes from a tear in the wall of the disc called the annular tear, and it must be in the back wall, not the front, not the side. Front tears, side tears do not cause pain. Only the back tears do. And that's because of the innervation. The nerve fibers that are in the back of the disc travel up the spine to the brain, and they go to a part of your brain that interprets information from the body as painful. And it's a highly localized pain because it goes to an area of your brain called the primary somatosensory cortex. Primary because it's the main sensory area of the neocortex being the newer part of the brain, which is your cortex around the brain, the neurons that are responsible for higher level thinking and perception. Without getting into too much neurophysiology, basically the signals go to a part of the brain that is highly somatotopic, meaning that it's a highly localized map of exactly where the signals are coming from. And this is, please don't hate me for saying this, but this is a part of the brain that is evolved recently in the last few million years compared to older parts of the brain that have been around for billion years, let's just say. And the brain is organized, and I'm not the one who came up with this, but the brain is organized into three parts. There's the oldest part of the brain, the paleocortex, which really is your brain stem and its neurons. And then you have the archicortex, which is the newer, like in the last few million years. And then you have the neocortex, which is the newest part of your brain. That's the part that Elon Musk is trying to alter with his little brain device. Okay? And so you have the paleocortex, archicortex, neocortex. And it basically, there's just three areas of the brain that have developed function over millennia, millions of years. And the most recent is the neocortex, and that gives us very high level thinking, processing of information. And one of those things is pain signals. So we're getting these electrical signals from nerves in your body, and this part of your brain has evolved over millions of years to be the highest level function of perception of sensory information, to be able to tell you exactly in your body where this bad pain is coming from, right? So if there's a mosquito on your arm, on your right hand, on the back of your right hand biting you, you can smack the back of your right hand without even looking, because you know that's where the signal came from. Your brain knows that. And that kind of information is helpful because, well, as you want to live longer and reproduce more, make offspring, and be more successful at adapting to your environment as the environment changes, there are bad animals, bad things that will attack you, and they will shorten your lifespan or ruin your ability to procreate, make babies. So these bad things in the environment, our body has developed a way of identifying their presence and avoiding them. And one of those is pain. So you can actually sense where you're being attacked on your body. Unfortunately, the disc tear, annular tear and herniation is an attack in a way, but it's not really, but your body perceives it that way. And that's why we're here fixing this disc. And I pioneered this technology, the first in the world to do it, and really the only ones in the world doing it at Deuk Spine Institute here in Florida, 2024. People travel from all over the world to get this done. This patient comes from Canada. He's here with his lovely wife. We love getting people out of pain. All right, any other questions? You can see the tear. That faint blue color is the herniation that's stuck in the tear. We're almost done with this disc. You can see the epidural space at 12 o'clock. There are some veins in there, And we're almost done removing, see that herniation right there, the blue stuff?
Yes, we do.
All right. Any questions?
Yes, next question coming from Azad once more on YouTube, asking any fears of cutting or injuring the cord with the laser procedure?
Well, I appreciate your concern, but no, I have no fear. Now, if you go somewhere else, you know, all bets are off. You could have a surgeon that does cut your cord. It's happened before, but not here at Deuk Spine Institute. So, just like everything else in life, it matters who does your surgery. And there's a lot of bad surgeons out there. Most spine surgeons, in my opinion, are technically not good. I would not let them operate on me. And you should not let them operate on you. But if you have me do your surgery, there's zero chance we're going to cut your spinal cord. You have somebody else operate on you, there's a higher chance that they're going to cut your spinal cord. How's that for an answer? You like that, Luis? That's the truth. Any other questions?
At this moment, no current questions.
All right. Let's show the old video. The Zach video. It's actually mine, but Zach created it with me. Let's show that video on what causes, the back pain from the disc.
Copy that?
For those of you who like the older version. All right, welcome back. You've seen Zach's version. That was our older version at Deuk Spine of the same video we showed you earlier. Both great videos, and we're just about done with this first disc. Remember, this is L4-5. I've cleaned out the herniation from the tear. The tear will now heal on its own. All right, there's the epidural space, there's the tear, what's left of it. There's a little bit more herniation right here we're going to dispense with, and we'll be done with this disc. Remember, this is L4-5. This disc was 9 out of 10 pain. 9 out of 10 pain. And it's concordant. You guys got that? 9 out of 10. A lot of scar tissue right here. This is chronic inflammation creates scar tissue. It means inflammation going on for years and years and years. So this has been a problem for this patient for many years. Just about done. 30 seconds on this disc and we'll be done. Any other questions for me, the surgeon?
No current questions, so we do have a comment coming from Bo on Facebook.
Hi Bo, welcome back.
Saying that I wish you guys worked better with insurance.
Oh, we work very well with insurance, Bo. The problem is your insurance doesn't want to pay for your care. And the reason is Every time they pay for something, they lose profits. So remember, your insurance is a for-profit company. They just want to make profit. So they're going to cover things that actually don't work so that you don't do them on your own. But if they cover something that works, then everybody's going to want it. They're going to lose their profits. Remember, it's not easy making $5 billion every 3 months profit. You got to work at that. It takes a lot of time, They've earned it, right? United Healthcare makes $5 billion every 3 months. Can you imagine making $5 billion after taxes every 3 months? Profit? I mean, that takes a lot of effort on their part to make that kind of money. So they don't want to lose that $5 billion profit every 3 months from not paying for your surgeries and treatment. They don't want to lose that. So, they got to not pay. So they can have their profit. And you... It's not shareholders. I don't think you understand. Nobody really understands insurance. Insurance was founded by a few rich people. They don't give a shit about the shareholders. The only reason they went public and they have shareholders is so that everyone doesn't look at them and go, how are you making $20 million every 3 months? Or $20 billion every 3 months? No one human should make $20 billion every 3 months. So they go public and they give a little bit of the company to the shareholders, and now, everyone's distracted by the shareholders. The reality is there's like 3 really rich guys who are taking in billions of dollars a month in profits because they're the ones who started the company, and nobody's looking at them because you don't know who they are, and they hide the money. Okay? And they don't take the money out as United Healthcare money. What they do is they hire, they make John Doe's cleaning service that cleans the building, and they charge $3 billion a week. And United pays $3 billion a week, and they own the cleaning company that gets $3 billion a week. There's no government regulation on cleaning companies making profits, but there is government regulation on health insurance companies making profits. People are too stupid to understand this stuff. I have to explain it to them. Man, Americans let all kinds of bad things happen. Look at what we're getting. Look at Bill Clinton, right? Think of all the shady deals. Even George Bush. They made all kinds of deals while they were president. And then they reap the benefits after office. They get paid these speaking fees. You know about the speaking fees? They go give a talk for an hour, and they get $1 million. Huh? No. Million bucks. I have a lot to say. Who's paying me $1 million to come talk? Nobody. It's basically a kickback for what they did while they were president in office. Giving business to Halliburton, starting a war with Iraq. Halliburton made $3 trillion on that war. They made $1 trillion a year in the first 3 years. Yeah, we're still paying for it. Okay. Would you go to war to give Halliburton $3 trillion? No. But why would our president do that? Because he's getting a kickback. That's why. And yet people don't get it. They... Shot? Yeah, it is offensive. But for the most part, most Americans are too stupid to understand what's really going on, especially when it comes to insurance. Insurance are the biggest crooks in our society. They take your money and then they don't want to pay when it comes time. And then these guys say, I wish you worked better with insurance, Dr. Deuk. Well, how is that my fault? It's your insurance that's not paying, not me. Anyway, as I've said 1,000 times before, don't blame us when your insurance doesn't pay. Blame yourself for letting it happen. Right? We have plenty of people who pay out of pocket for these surgeries because they understand the value to their life. And someday insurance will pay, but it's not because of anything you guys do. It's because of me fighting and spending my own personal money to get insurance to pay. I've spent millions of dollars in legal fees to build a case against the insurance companies out of my pocket. Most people will never understand that. Anyway, next question.
Next question coming from Jerry on Facebook.
Uh-huh.
Jerry asks, Jerry from Vietnam, how often...
Oh, Jerry, nice to have you back.
They asked, how often is the laser required to be calibrated or pre-tested to use? And how much radiation exposure do you get from all the x-ray shots? And do you also require film badges?
Damn!
Every 6 months.
You're on fire today. Just check first. So the laser is calibrated routinely as per manufacturer's specifications, which usually is around every 6 months. We're constantly servicing them with technicians, and Luis is the man who oversees our fleet of lasers. We have 10 of them now. Second of all, radiation. Yes, we get radiated. It's one of the things that most patients don't appreciate, that their surgeon and the operating team takes the radiation for them so they can get their surgery. But the radiation's lethal. Basically, I'm killing myself every time I operate. A little bit more. Why do we do it? Because it makes it safer and better for the patient. So it's sacrifice. For those of you who aren't used to sacrificing, it's something you don't understand. But for somebody like me who sacrificed my entire life for other people, it's something we just do as part of the job. Now, that said, I'm not an idiot. I'm not going to expose myself to radiation unnecessarily. And we do everything we can to minimize the amount of radiation we get exposed to. So we do things like pulsing. We do things like collimator. We do things like, basically being smart about taking pictures. A lot of surgeons actually don't realize the radiation is lethal, and they just sit there and radiate away without thinking about it, because it's invisible. But yes, we wear badges. We all wear badges. It's required. We have dosimetry badges, and they basically get collected every month, and they look at the amount of radiation each personnel is getting to make sure there's nothing weird going on. Also, I spend a lot of money on the best equipment in the world that releases the proper amount of radiation, not too much, not too little, just the right amount. And these machines, that when you buy them, they're almost $200,000 a machine. So they're very expensive. You can buy cheaper ones that give more radiation and more what's called scatter radiation, which is the term used for radiation that doesn't do any good. It just radiates people. It's called scatter. You don't want scatter radiation. So the better quality machines, the newer machines, have less scatter. There's other things we can do to reduce scatter as well. Point is, at Deuk Spine, we provide the least amount of radiation possible with our surgeries. And that's because we have the best equipment and we know what we're doing, and we're very conscientious about it. We don't want our staff or the patient getting additional exposure more than they need. So, fact is, all orthopedic procedures, all spine procedures require the use of radiation in the form of x-rays. Diagnostic x-rays. Luis, what do you think that bubble is at the top? Is there a bubble at the top? Is there a bubble at the top?
Yeah, I see that.
No, you get my question though.
Yes,
I understand your question. You get it. Thank you. Thanks for acknowledging that I'm not the only one seeing a bubble at the top. I didn't know if I had to go back and visit the eye surgeon again.
I understood what you were saying.
Yeah, I know you do. All right. I'm a bit of a jokester today. All right, Henry, any other questions from our audience?
Yes, this next question coming from Tracy on Facebook.
Hello, Tracy on Facebook. Welcome to our live stream at Deuk Spine.
asking, I understand the discogram provoking pain in an inflamed disc. However, do you have anything to compare it to, given that you're likely never performed a discogram on a non-painful disc?
Hey, great question, Tracy. The answer is yes. The good news is we've performed discograms on non-painful discs in the past because we used to use discogram as a diagnostic tool, where the patient would just show up and we do a discogram to figure out which disc hurt. We did that for many years. Oh, many years. And we had discs that weren't painful. As a matter of fact, they were required as part of the discogram. You had to do a discogram on a non-painful disc. That was the control level to verify the painful ones were real. So we have lots of experience doing discograms on painful and non-painful discs. It just so happens that we've gotten really good at figuring out which ones are painful just by looking at the patient, where their pain is, looking at their MRI, correlating the pain to the disc. So basically I do a visual discogram with my eyes, and I verified in the operating room. Great question, Tracy. Thanks for asking. Do I know you, Tracy?
That is a very good question.
You don't have to answer that.
Not a
All
problem.
right, got Henry, we got about 2 minutes. We're done.
Copy
Then
that.
we're going to end this broadcast. We're going to pick it up again with our piriformis. So I would answer any other questions, and then we should probably end so you can be ready for our left piriformis release.
You got it. Copy that. We have a couple more questions. This next one coming from Izod once more on YouTube,
Hello, Izod. Thanks.
asking, what if a non-herniated part of the disc is removed along with the herniated part? Will it create any problems with that herniated part?
So removing a non-herniated part of the disc rather than a herniated part or along with the herniated part, it depends on how much is removed, my friend. If you remove too much, it will create instability. You'll have to have a fusion surgery or artificial disc. We don't do that. We're using a very small tube, and the laser is very precise, so I don't remove non-herniated parts of the disc. So if you're asking if I would do it, the answer is no. It won't happen with me. Could it happen with somebody else if you go somewhere else for surgery? Yeah. Lots of surgeons remove parts of the disc that are not herniated. It's called a discectomy. And I don't do that because it hurts the patient. It ultimately creates instability, and then they need a fusion, which is good business, by the way, for the other surgeons, not for me. I don't like doing fusions. I don't want to do a fusion. I don't want the patient to have a fusion. Fusions are dangerous surgeries. They're very invasive and painful. So removing non-herniated parts of the disc lead to having to have fusion. We don't want that for our patients. Good question.
Next question coming from Samir on YouTube,
Hi, Samir.
asking, do you think collagen supplement will help the disc heal faster after surgery?
Do I think collagen supplement will help the disc heal faster after surgery? The answer is I don't know. I don't think it can hurt. Having collagen supplement will not hurt, but it may help. I just can't say it will help. I mean, you'd think it would help, but the truth is, let's pretend for one moment that the person asking is a protein deficient vegetarian, meaning you eat no protein, you're deficient in protein, and you're a vegetarian. But we could even say just protein deficient. They don't get enough protein in their diet. They're lacking protein. Would having collagen supplements help? Absolutely. Collagen is a protein. So, is it necessary? No. We've done 2,000 of these surgeries. Oh, broken.
Maybe more.
Broken.
What is it?
Broken.
Can I have another one, please? No?
Yeah, it's busted.
Please.
All right, let's get the laser in. We need to order some more of those, Luis.
Yes, sir. Yeah.
See if we can find some used ones. If not, order new.
No problem.
But we need more.
Yeah.
Yeah, they do fail after a while. All right, next question.
Next question coming from Izod once more on YouTube, asking, will non-herniated discs, if removed with this procedure, regrow? Or in other words, will it heal up?
No, the non-herniated part of the disc never regrows. You cannot make more disc. You can make the annulus, which is the outer part of the disc, but you can't make more nucleus. Your body can make more annulus, but not more nucleus. And it's the annulus part of the disc that's made out of collagen. The nucleus is made from the notochord, which is an embryological structure. That's why you can't make more, because it's made during when you're just developing as a fetus. So once you're born, you can't make more of it. And people have tried making more because it's big money. But you don't need it. You don't need the nucleus at all. You could take all your nucleus out right now and not have any problems. There are people that have no nucleus in their disc. Lots, millions of people. They have no nucleus and they're fine. They have no symptoms. You have another grabber?
Yes, sir.
Yeah. So right now we're close to being done. I'm about 5 minutes away. This is the back of the disc at L4-S1, the hardest disc to fix. There's a lot of herniation and scar tissue that I've been removing. There's still some left. I'm going to try to get rid of it, as much of it as I can.
We have a comment and a question.
Sure.
This comment coming
5
from Bo, once more on
Remember, we
Facebook.
have the piriformis too. Yes, Bo.
Bo said, I am not mad at you, Doc, just a letdown when you get the info from the ones who call and tell you what's up. Just watching you makes me hopeful, but finding out the circumstances is a letdown.
No, I appreciate that, Bo, and thank you for the comment. I'm mad. I'm not mad at you, Bo. I'm mad at the insurance companies because they lie to people. They tell people that they have great insurance. They take your money every month. And then when it comes to paying for medical care, they try to not pay. And by the way, it's the insurance companies not paying for medical care that is the #1 reason in America for what's called bankruptcy. If you look at the #1 reason in America for bankruptcy, and it's been true for the last 40 years, since the insurance companies have been denying payments since the 80s, the #1 reason for bankruptcy is unpaid medical debt. Unpaid medical debt. So here's how it works. You go to the hospital or a doctor, you get a procedure, they treat you, and your insurance company gets billed and they don't pay. They deny it. That way they can make more profit. Well, guess what happens? The hospital or doctor bill you. And if you don't pay that bill, which you're like, wait a second, I'm not supposed to pay this, my insurance is, right? You don't pay. So now you have debt. And the only way to get rid of that debt is bankruptcy. So the insurance companies play this game. They know how it works. So they basically force people into bankruptcy by not paying their medical bills. It's disgusting. And most Americans have no clue what's happening. They were just like a little baby sucking on their thumb rather than their mama's teat trying to get milk. Your thumb provides no nourishment, just psychological solstice. Anyway, it's upsetting to me because the lies that the insurance companies tell people. Oh, you got great insurance. Yeah, we cover surgery. We cover everything you need. Well, they don't. Then when it comes time for you to get your surgery, oh, we don't cover that. It's not necessary. Oh, that's experimental. As long as they say the surgery is experimental, by law, they don't have to pay for it. You see? But the law requires them to pay unless it's experimental. So they call it experimental so they don't have to pay. Of course it's not experimental. We've been doing this surgery for 18 years. We've published the results. They've been peer-reviewed and published. There's nothing experimental about it. All right, there's just a little bit left there I got to try to get. Berndes, I just need a couple of minutes. And we got the piriformis next. So I would take the last few questions. Let's do this last bit of 5-1, and then we'll shut down this broadcast and bring it back. Wake up. You were doing so good, Nikki. Don't watch, do. And then we'll show you guys the piriformis release. Okay? That's a bone spur. Oh yeah, I'm getting as far over as I can. Scope use will be a 7.
We do have another question
We'll take the last question.
coming from Tracy saying, well, first off, she said, yes, you do know me and the toe lady. And
Oh yeah.
her question is, are you aware of anyone working on the technology of combining an ultrasound with a fluoroscope?
No. No. No, I'm not the kind of person who foo-foos things, but I'm not sure what the benefit of that would be. So maybe there's something. Grabber, we're pretty much done here. I've gotten all the herniation out that I can. It should be enough. Probably got about 50%. Even broke one of my own instruments doing it. All right, good. That should be it. The nerve itself is going to be just to the left here. In that blood vessels are around the nerve. That's the left L5 nerve root. Huh? All right, let's end the broadcast and we'll come back with our piriformis.
Copy that.